Hi, Lee. Thank you for joining us today. We're talking about original Medicare and supplements today. We will cover Medicare Advantage in another conversation. So I'll let Lee open it up and start with original Medicare, and what's covered under that.
So let's take just a quick step back and say, when can I enroll in original Medicare? And so you can enroll 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after your 65th birthday. You may also have an opportunity to enroll during a special enrollment period. And that could be when you leave your group health plan and retire from working. So don't feel like you only have your 65th birthday to do this at, because you do have special enrollments also.
Is there any other examples of special enrollments? So you said leaving your group plan. Any other special enrollment periods? Like, what would that be?
So a special enrollment period could be you stop working, you move, and you're on a particular plan that's geographically tied to where you live, and you move out of that geographic area. That's a special enrollment. You could also have a special enrollment period if your 65th birthday occurred and you are in a natural disaster. For example, you had a hurricane come through, or you had flooding, and you weren't able to enroll because you were dealing with the natural disaster. So that's a new special enrollment period for you. The catch to that one is your state or county has to be declared a natural disaster in order for that to be a usable enrollment. You could also be, you could divorce. That could be a special enrollment because maybe my spouse is carrying my coverage and I'm older than they are. And then when we divorce, now I have no coverage. And so because of the divorce, that gives me an opportunity to get my Medicare at that point in time. Okay.
Is leaving, you mentioned earlier one of the special enrollment periods is leaving work. Is it dependent on you having coverage at work, or is it just strictly you leaving work and retiring?
Yes, it's dependent on you having medical coverage through your group plan.
So someone that didn't have coverage at work, leaving work isn't a special enrollment period.
That's right.
Okay.
That's right, because they probably jumped on Medicare when they were 65 because they didn't have any other medical coverage.
Mm-hmm.
Okay.
Okay.
So let's start with original Medicare. There's 3 basic parts to original Medicare, and those are called parts. Part A is hospital insurance, and that includes when you're in an inpatient situation, admitted to the hospital, have the bracelet on your arm, and get your meals in your room, okay? You have an annual deductible of $1,700 if you're admitted on original Medicare. Now, most people don't pay a monthly premium for Part A because they've worked at least 10 years in the U.S. or 40 quarters. Now, if I'm married and I raised the children and my spouse worked, then I still get that Part A at no cost by virtue of him working or her working, okay? So most people don't pay for Part A. Part B is medical insurance, which includes doctor visits and outpatient services. So that's all the stuff you have under your group plan that you usually have co-pays for or co-insurance for. MRIs, CTs, going to the doctor, having blood work, x-rays, all that kind of stuff. That's outpatient and therefore is subject to an annual deductible of $288 for 2026 and a premium each month of $207 in 2026. Each year, the premium and the deductibles rise slightly. Okay? Questions so far? Okay. The last part is Part D for drugs. And a lot of people miss this because there's nothing to say, get a Part D when you get your Part B. And unfortunately, when you go online, the Social Security website is where you go to apply for Medicare two totally separate benefits, but one website that you go to. So when you apply for Part B as in boy, you also have to get a Part D as in drugs. Because if you don't get a Part D, when you get your Part B, you'll be assessed a penalty when you do go to get your Part D for drugs. And that penalty is 1% of the national premium for each month you did not have a Part D coverage. And you think, oh, well, it's going to be, $4, $5, $10, $15, $12, $20, $25 per month for the rest of your life. It adds up.
So for all the people out there that are going to go sign up for Medicare, and I'm like, well, hey, I just don't really take, prescriptions or drugs like that. Your recommendation then would be what? Just pick the very basic plan, the cheapest plan, just for now, because then later you can always change it.
That's right.
Is that the answer?
That's right, because Part D has to be in place when you have a Part B. Otherwise, you'll be having that lifetime penalty. Right now, there are some zero premium plans, and even though you don't pay anything month to month, you still have that coverage, and therefore are out of getting a penalty.
So in that case, there's really nothing to lose in signing up for Part D at first, because you can actually pay zero up front.
That's right.
So everyone should sign up for B and D together at all times.
That's correct.
Never not sign up for both of them.
That's right.
Okay.
Never not sign up for both. You can sign up for Part A even if you're still working, and many employers ask that you sign up for Part A because your Part A will work with your group insurance, so that if you have a deductible or something that your group insurance doesn't cover, Medicare Part A may pick that up. So that's why you want to go ahead and start with Part A when you're 65, and then get B and D when you actually lose your group coverage.
Okay.
All right? So next year, in the year 2026, the Part B premium is $207. And then I guesstimated a Part D at around $90 for somebody who takes an average amount of prescriptions. Right now, as of this point in time, we have not seen the pricing for Part D yet. We won't see that until the 1st of October. By rule from Centers for Medicare and Medicaid Services, the insurance companies cannot release information until October 1st. To begin enrollment on October 15th. So that means it's really tight for the insurance companies to get everything ready to go. And for agents, they can't talk to people about costs and plans until after October 1st.
Wow.
So it's really important that if you are unsure of what you want to do, and you've already worked with an agent, reach out to that agent and say, help me, what do I need to do? And they're probably going to say, I'm so glad you called, but I can't really tell you anything until October 1st. But at least you're on that agent's radar to know that you want help, because they don't know otherwise. Because as an agent, you can't make blind calls to say to somebody, do you need help? They have to be already in your book of business for you as an agent to reach out and call.
How? I don't understand that, but okay.
Okay, so
Wow.
already this year I've had two people.
Can't help anybody.
That's right. Not until they reach out to us. We can't help until they reach out to us.
Wow.
And the rules were put in place to help the seniors so they're not being taken advantage of.
Yeah.
But at the same time, I've had two people already this year call me and say, I got switched out of my plan and I don't know how I did it. And I'm like, what do you mean you got switched out? And they said, well, I'm no longer in the plan you signed me up for. And I said, so somebody called you and they said, we're going to enroll you in a new plan. And you had to say yes. But there's a lot of different ways and tactics out there where they're not forthright and clear and transparent. So be careful. If you get a phone call from somebody that is not your normal insurance agent, say, I'm not interested, and hang up. because it's not worth your hassle and your headaches, because you could get switched out of a plan and be stuck in that plan for a whole year.
Wow.
Okay?
And then with respect to if, as long as they're staying in the plan that you signed them up for, the increase in premiums, which you're waiting for, are October 1st.
That's right.
Is there a cap on how much they could go up? Like, can they say, okay, I should expect $15, $20, or is there a max?
So on the original Medicare, Part B and D, the annual deductibles are set by Congress, and the increase for the premiums are also done through a congressional act, and they're set up to go not more than 5%.
Okay.
Literally, it would take an act of Congress to move the monthly premium higher than 5%.
Okay.
That's been set up by by federal law.
Okay.
Okay.
But you do see some maybe only go up 1%.
On occasion,
Okay.
yes, but given the time we're living in and the amount of people that
Yeah.
are getting care and everything, I would imagine we're going to see that 5% each year with no question asked, and we may even see something to the effect that it would be higher passed through Congress. We just don't know.
Okay. Okay.
Okay? So that's the original Medicare.
Okay.
3 parts: Part A, Part B, and Part D for drugs.
Okay.
Okay. Part B, after you meet your deductible, you pay 20%, and there's no stop limit on original Medicare. As long as you're getting services, you're going to continue to pay 20% because Medicare pays 80%. Medicare does not pay 100% of any services. You always pay a portion. And a lot of people don't realize that. They think that Medicare is going to pay 100% of everything, and they don't. So it's important to remember that if you want to stay with original Medicare, you're always going to pay, whenever you get services, you're going to pay at least 20%, and it could be more depending upon your doctor. And there's no stop limit.
Okay.
That's important. So what if you don't want to pay that 20%? You could get a supplement. And a supplement covers those costs that Medicare asks you to pay. All right? So you still have your Part A, your Part B, and your Part D, but now you have a choice of supplement plans. And they range from A, B, D, G, K, L, M, and N. Or if you turn 65 before 2020, you may also have a Plan C or a Plan F. Those 2 plans are no longer available unless you turned 65 before 2020. The best plan that someone can get now is a Plan G, and that covers everything that Medicare pays for except your Part B deductible. So let me say that again. Plan G is the most comprehensive coverage because if Medicare pays, the plan pays your portion, except for your Part B deductible. So that first $288 is on you, and then if Medicare pays, the plan pays the balance after the $288.
And just to be very clear, so Part G, Plan G, would cover that 20% you were talking about earlier.
That's right.
Would cover the $1,700 deductible for Part A.
Correct.
Would cover any deductible on Part D, depending on what your plan is, but whatever, it would not cover that.
It does not cover the deductible on Part D, but it covers Parts A and B costs
Okay.
for you.
So it's everything in Part A and B minus the Part B deductible.
Correct.
Okay.
Okay, and that's Plan G, the most comprehensive. All right. The other most comprehensive plan is Plan N, is in Nancy, and that plan pays everything except when you go to the doctor, you have up to a $20 copay, and when you go to an emergency room, you have up to a $50 copay for an emergency room visit. But usually the difference between N and G is less than $50 a month. So if you're not going to save a whole bunch of money between N and G, you might as well pick the G and not worry about having a copay to pay at all. Because if right now you might not go to the doctor, but 10 years from now you might go to the doctor 4 times in a month. And then your N doesn't make sense anymore. And you may not be able to get to a G because you'd be underwritten and you may be turned down or rated up.
Okay, so in that example you're talking about, someone just gets Medicare, they're relatively healthy, they don't go to the doctor a lot, so they think, I'm going to save money and do Part N.
Correct. Plan N.
Plan N, excuse me.
Mm-hmm.
But then what you're saying is that it'd be smarter to now just do Plan G, because if they do Plan N now and wait for Plan G later, it could be either, I guess, A, more expensive, or it could be, like you said, they could be turned down because I'm guessing there's some sort of medical exam or something to be qualified.
They have to go through medical underwriting.
Okay.
And that's a series of questions. And you can see what those questions are before you apply. And the other thing is you're not taken off of the current plan until you're accepted on the new plan. So you're never without coverage once you're on a supplement. The key thing is to remember with a supplement is you choose carefully, because that's probably the plan you're going to be on for the rest of your life.
So will they exclude conditions or just increase your premium?
Some companies will totally exclude you from their plan. Other companies will rate you higher. And we're talking about somebody going from like $160 to $170 up to over $500 a month when I say rated higher. I mean, it's double, triple the regular rate.
Okay.
Because they know going in you have certain medical conditions that are going to cost them more money.
Mm-hmm.
But at the same time, you're thinking, man, that's $500 a month. But if you get $150,000 of care in a month, and you pay $500 for all of that care, that's not such a bad deal.
Yeah, it takes one major event to really,
Yes, it does.
Okay.
So pick carefully when you pick for a supplement, because keep in mind that supplement is going to be what you keep most of the time for the rest of your life.
And in this chart for plans K, L, and M, these are copays. This 50%, 75%, that's the copay.
That's
Okay.
right. So in other words, let's look at Plan L. So you'll notice that you still have to pay your $288, which is your deductible. And then the insurance company is going to pay 75% of your 20%. So let's take an example.
Oh.
I go to the doctor. I've already paid my $288, and I'm on Plan L. I have a $100 doctor bill. Medicare pays $80. The plan is going to pay 75% of that $20.
Okay.
Of that $20. And so I then pay $5.
Okay.
But Plan L has a stop limit. Once I spend $3,600 out of my pocket, then the plan pays 100%. So I pay 25% of the original 20% until I spend $3,600 out of my pocket.
Okay.
And keep in mind that whatever the costs are for the plans, it's in addition to your $206.50, which is your monthly premium for your Part B, and your Part D for drug premium, whatever that could be. And then if you want to have dental or vision or any other coverages, that's going to be an additional amount on top of the 206, the Part D, and your supplement costs.
Do you have dental and vision sometimes included with these companies? They're always different companies.
The supplements are, sometimes the supplement companies do offer a standalone dental and vision to pair up
Okay.
with your supplements, but it's never included in your supplement. It's always a separate charge.
Okay.
And sometimes it makes sense to put your dental and vision with your supplement company because sometimes they'll offer you a discount. But once again, you want to think carefully and look at all the details. Many of the standalone dental and vision plans have waiting periods, and you may have to pay into that plan for 6 months before you can have a filling covered at 50%. And you may have to pay into that plan for a full year and a half before you have 80% coverage on that filling. You may not have any coverage for big stuff, root canal, crowns, until you've been on the plan for a whole year, and then you may only have 20% coverage. It usually takes 2 to 3 years for you to get a typical dental plan, which is 100% preventive, 80% on basic services, which is fillings, and then 50% on big stuff, which is major services, crowns, root canals, that kind of thing. 2 to 3 years on an individual plan until you reach that level of coverage. Because the insurance company wants you to pay in your premium before they start paying out a chunk of money for you to have services.
Wow. Okay. And as far as doctors staying with the network of the plan, so if I choose G with Blue Cross Blue Shield, is that doctor always on L with Blue Cross Blue Shield? Or maybe that doctor only does G?
The supplements have no networks.
Okay.
As long as your doctor takes Medicare,
Okay.
they'll take your supplement.
Okay.
Okay? And that's the same with hospitals. So we're very fortunate that we live in an area where we have a lot of competing medical facilities, and there's a lot of plans that do not take MD Anderson. But MD Anderson takes Medicare, so they'll take your supplement. So somebody who's on a supplement can get treatment at MD Anderson. But if they're on a Medicare Advantage plan, they're probably not going to be able to go to MD Anderson unless they pay the cost out of their pocket because there's networks.
Okay. And dental and vision, is that true for them too?
Dental and vision also have networks.
They do have networks.
Yes,
Okay.
and it's important if you're going to get a dental plan that you get a PPO network,
Okay.
not a DHMO or what we call a closed network, because what you're doing then essentially is you're buying a discount plan because you're always going to have to pay for services. You may not have a deductible, and you may not have a limit on how much benefit you'll get in a calendar year, but you're going to always pay for your services. And that's called a dental organization, maintenance organization. Just like an HMO for medical, it's a DMO.
Okay.
Okay? So it's important to look at a PPO
Okay.
for your dental plan.
Okay.
Many companies, dentists will take a PPO, but not a DHMO.
And then if you need a root canal, you need a referral or something. Or something if the dentist doesn't do it.
Usually, it doesn't need a referral, so to speak.
Okay.
It more than likely, it would be advisable to have the dentist do a pre-treatment plan. And that's when they fill out exactly what they want to do, send it into the dental plan insurance carrier, and then the insurance carrier will send back to the dentist and say, okay, out of the $1,500 that you're submitting for the crown, the plan is going to pay $750. The patient would be responsible for the other $750. And it's important that you, as the patient, get a copy of that and hang on to that copy, because if for some reason you have the work done and then the dental carrier does not pay what they said they would, then you have your paperwork and you can go back and say, but you said you were going to pay $750 and you only paid $600. Why? And then, because you're going to pay that extra $150, because the dentist isn't going to,
Yeah, eat it.
he's not going to,
I've had that happen just on regular insurance before. Yeah.
The dentist is going to do what they call balance bill. So if the insurance carrier only pays $600, then you're going to pay the other $9. But if you have that pre-treatment plan, and it's important to ask the dentist, did you submit a pre-treatment plan? No? Then could you submit one?
Yeah.
Or give me the paperwork and I'll submit it. And then don't have the services done until you know what you're going to be responsible for.
Yeah. And vision similar?
Vision is not quite as bad because vision, although the cost of glasses is quite high,
It is.
the vision plan is very limited, usually to a couple of $100 in terms of a benefit.
Okay.
So it's not as big of a deal as it is with dental.
Okay.
And usually your vision coverage is considerably less expensive than dental, and dental is considerably less expensive than whatever you're doing for your health insurance.
Okay, so this is all, when you talk about monthly costs, this is all for people within a certain income range.
Well, it's all for everybody who's on Medicare,
Okay.
because your Part A may have a cost if you haven't worked 10 years.
Okay.
Okay, but you're for sure going to have a Part B cost, and you're sure going to have a Part D. It may be 0, but you still have to make sure you have a Part D.
Okay.
And then you still may have other costs on top of that. But at a minimum, you're going to have a Part B premium and a Part D premium,
Okay.
regardless.
And then what if I make over a certain threshold?
So that's going to be what we call an income adjustment, an income-related adjustment amount,
Okay.
or IRMA. So if you or your spouse file taxes jointly and have a modified gross income of more than $218,000 for the year, and this is for the year of 2026.
Okay.
No, I'm sorry. This is for the year of 2024. They're always looking back 2 years ago
Okay.
at your taxes. So you're looking for your modified adjusted gross income for 2 years back.
Okay.
So in 26, we'll be looking at 24. And if you have a adjusted gross income of more than $218,000, you would be subject to what's called an income-related monthly adjustment amount, or IRMA. And that is a surcharge that both you and your spouse will pay on Part B and Part D
Okay.
each month, in addition to your monthly premiums.
And that's something that never goes away. For as long as they have Medicare, their premiums are escalate or are higher.
Their premiums are higher, but remember, it's tied to their adjusted gross income. So when they were working, if they had a higher wage, then they probably are going to have that for at least 2 years on Medicare.
Okay.
Because unless they're consulting and getting still a pretty healthy consulting fee, then they still could have it for a little bit farther into retirement. It just really depends on what's going on with that particular income situation.
So IRMA isn't like the penalty earlier you talked about where it's forever. IRMA is just strictly, like you said, that past 2 years or from 2 years ago.
Correct.
Okay. So as they retire and maybe their income goes down,
That's right.
then it'll be adjusted over time and it'll come down.
Usually
as well.
by the time you hit 72 to 75, you should see that IRMA being reduced or taken away totally.
Okay.
The other way you could get an IRMA is if you sell property or have an inheritance or something like that, and your adjusted gross income shoots up for 1 year when someone passes.
Wow.
Then you could also be having an IRMA for that. If you have mineral rights or something like that that go into your adjusted gross income that raises that adjusted gross income, even though you're retired, you still could pay IRMA longer because you have that additional income coming in.
So for IRMA, there's really no exceptions.
There are exceptions. There are 2 exceptions that we found recently. There used to be an opportunity to appeal. They've taken those reasons away, and so the only two appealable reasons that we found that work is, number 1, if you have a windfall and you can prove it, you're probably going to get the second year taken away, but not the first year. The other thing is, if you're getting mineral rights or something to that nature, then you have a chance. It just depends on who's ever approving or denying the process for you. That is done right this minute.
Wow.
That is done by an actual human being. I can see that going to an AI system very quickly, because CMS has lost about 40% of their workforce.
Yeah.
And so anything that they can look to automate or put into an automated process, I can see that happening very quickly. So
Does that decision happen at the state level?
no, that happens
That's
at the
federal.
federal level, because this is all a federal program.
Right. Interesting.
It's important too when we're talking about supplements. Even though there's many carriers out there that offers the supplements, the prices vary greatly.
Okay.
So it's important that you pick wisely. And just because they have a lower price today, it's important to look and see when was the last time that carrier filed rates with the state. Because this is driven by the carrier, and the carrier has to plan and get their rates approved by the state. And so, for example, United Healthcare, they get their rates adjusted every June 1st. Other companies don't have a set date necessarily. They could have, like maybe say Blue Cross, they could say, you know what, we filed our rates in 2024 and we don't need to make any adjustments until 2027 or 2026. And so in 2027 or 2026, people that are with Blue Cross Blue Shield supplements, they may see a 20 or 25% increase in their rates all at once. And then they may go along for another couple of years and not see any increases. So it's important to choose carefully.
That's rates of an existing patient under that carrier person.
It's rates under that supplement. So
Under
if you're
that supplement.
yeah, so once you're enrolled in that supplement,
Okay.
you could be at that same rate for a year or 2, maybe 3, and then all of a sudden you get a 20 or 25% increase because everybody in the state is getting the increase as well.
And then if you switch carriers because of that, you're having to be rewritten at that current age, not
You're
Just so-
rewritten
yeah.
at the current age, and you're also rewritten at the current health conditions.
Yes.
So once again, this is a time when you could be rated up or potentially turned down.
so shopping around is not necessarily
Shopping around
beneficial.
is a good thing when you're starting out, but once you're on it, bite the bullet and say I'm on it.
Yeah, so earlier, even when you mentioned, you probably want to pick a plan and stick with it. The same is true for the carrier, then, from what I'm hearing.
Yes,
Okay.
for sure.
Okay.
Whether it's a plan or carrier, you want to stay on that supplement. We don't advise changing supplements because you can always go down, but you have a harder time going up in terms of getting comprehensive coverage because that's when you can be rated up or turned down.
So in that example, if you were with United Healthcare and you have the Plan G, and you were to go down to Plan N, so they wouldn't
They don't re-rate you
Okay.
at that time. You can. United Healthcare is one of the only carriers that allows you to move freely from whatever plan you want to another plan, and they don't re-rate you. They just give you the rate of that particular plan.
So in United Healthcare, you can go either way, up or down.
That's right.
Okay.
But when you go up, you have to go through underwriting. That's why I say start at the most comprehensive plan and go down.
Okay.
Okay? Now, on the other carriers, they may also re-rate you when you go down.
have the option.
They have the option to do that. That's another reason why United Healthcare writes all the business that they do, is because they have some perks inside of their plans that aren't widely known. So many people know about United Healthcare and have family members on United Healthcare because they've been around, they've done this program for a long time, and they know what they're doing. So that's a good thing.
Yeah.
But it's also a bad thing, because when you're the consumer, you know that they're making money. But at the same time, when you're the consumer and you need to have care, and you need to have a lot of care, you know they're going to be there to pay for that care for you.
Yeah.
Right.
And there's never a worry.
Yeah. That is, cheaper isn't always better, you know,
That's correct.
with insurance. Yeah.
That's right. You get what you pay for.
Yeah.
And sometimes that low-end plan is going to have a huge increase at some point in time, because they can't afford to keep paying the claims at that low rate. Because as we get older, we get more expensive in needing care. And more people are getting care longer and more often. I just read an article the other day where by the year 2035, we will see 4 times as many people living into their 100s than we do now. 4 times as many.
Interesting.
One other thing, I just read an article this week about, and I want to make sure we bring it up, and that is something that is new for Medicare people. In the state of Texas, we are piloting a program for prior authorization for certain procedures. And we are one of 6 states that are piloting this program for Medicare. So what this means is there are several procedures that you may need to have prior authorization from Medicare to have that procedure or process done, which is new, because before doctor said you needed to have it done, you went and had it done, Medicare paid, and you went on your way. Now they're seeing that there is potential for fraud, waste, and abuse in the Medicare system, so they're trying to start monitoring the system a little more closely. And unfortunately, the state of Texas was one of the states chosen for this program. And so there are certain procedures. I can recall arthroscopy of your knee, spinal injections, steroids for your spinal injection, and fusions. Those were the three of the several that I remember that are on the list that now have to be pre-authorized. So that means your doctor has to pre-authorize the procedure with Medicare. Totally new, beginning January 1 this year of 2026.
And have they indicated how long that process is to get approval?
They have not. I will send you the link so that you can post that link for your clientele that would like to read it.
Someone in pain is saying, I'd like that approval in 24 hours.
Of course.
But yeah.
Yeah,
it's even with regular insurance, I know it can take sometimes a week or more.
That's right.
And we're talking about the government, so.
That's right. And we're also talking about of an arm of the government that has lost 40% of their workforce. They're saying that this approval will be done with AI and doctors overseeing. However, I still don't know how long it's going to take, and we just don't know a lot of things. There's like I said, it's just 6 states that are doing it, and Texas is one of the 6.
Is there an official name for the pilot program? Maybe it's in the article.
I don't believe so. Yes, it's called WISER, WISER.
Okay.
I do remember that. But I will send you that article so you
Okay.
can post it.
Yeah. Interesting.
Yeah. Then that's starting January 1st, 2026.
Wow. Lots to think about.
Yeah.
We talked about IRMA just a little bit. I'm going to also be sure to give you the IRMA projected guidelines for 2026.
Okay.
Once again, those are not set in stone yet. October 1st, again, is going to be the date that they'll be set in stone for 2026. But I have the projected numbers for 2026. And remember, that's on Part B and Part D, and it's for both you and your spouse.
So remind me, October 15th is when you have open enrollment for supplements.
October 15th is when you have open enrollment for Medicare Advantage Plans and Part D. So
And Part D.
remember, if you're on
Okay.
the supplement, you really don't change.
Okay.
You can change your drug plan, though.
Okay.
Okay?
Otherwise, it's the 65 or enrollment period.
Special enrollment.
Special enrollment
Mhm.
period. Okay.
That's correct.
Okay.
3 months before, the month of, and the month after your 65th birthday, or a special enrollment period.
And it's October 15th for Medicare Advantage through the
December,
end of the year?
December 7th,
December 7th.
and that becomes effective January 1st of the next year.
Okay. Okay. And we will be discussing Medicare Advantage in another conversation.
That's
just
correct.
to keep it simple.
That's correct.
Today. Very good. I think this was helpful. Slow and processing
Yeah.
as we're going.
And as you go along, there's lots of questions. And keep in mind, too, that if you talk to your neighbor or a family friend or a trusted person that you know and believe in, every person is different because everybody's medical needs are different. And so the plan that worked for your sister may not work for you because her needs are different than your needs. And the plan that worked for your neighbor may not work for you. So you need to make sure that it's a plan for you
Yeah.
or your spouse, and your spouse can be on a different plan than you are. And that's okay because you're two separate people and you have separate needs.
I think that is a misconception maybe for a lot of couples to think they could be on different plans.
They can be on different plans and they can be with different carriers. They can be on different types of plans. Your spouse could be on a plan G and you could be on a plan N because you don't need a lot of care right now and you don't feel like you're going to need a lot of care. And maybe your family history doesn't show that you need a lot of care.
Okay.
So you can be on different plans. You could also be with different types of plans. Your spouse could be on a supplement and you could be on an Advantage plan. I have seen couples do that because of cost reasons and because the Medicare Advantage plans are considerably less expensive, but you pay when you get care. So
Interesting.
you pick and choose what you need for your needs.
Okay. Anything else?
Yeah, that's it.
I think that was a good overview. Thank you for joining
Thank you
us.
so much.
Thank you for having me. Appreciate your time.